So how do you fix a crooked nose? Hi, I'm Dr. Steve Wallach, a board-certified plastic surgeon in New York City with more than 25 years of experience. If you like this video, please tap the little heart button in the top of your screen. So what makes a nose crooked? Or what are the structures that are deviated in a crooked nose? Well, it's primarily the bones, which make up the upper third, this area of the nose, and then the septum, which is the lower 2/3 of the nose. The tip can be displaced related to the septum as well. Also, we have some normal deviations in the base of where the nose sits on the face. So the bones on each side of the face may be a little asymmetric. That you can't really change too much. So in fixing the nose, the way I like to do it is opening it, doing an open rhinoplasty. Once you release the soft tissue, which may also contribute to the deviation, you then can visualize the bones as well as the septum very clearly. So the septum is usually the structure that mostly contributes to the deviation in most cases. And that can be curved in this plane up and down. It can be from here down to here, it can be curved. It can be curved from side to side, and it can be curved in different planes like a piece of paper. So it can be bent in many different ways, even like this or like that, etc. So once you see the septum and its curvature, you then fix that deviation. And how do you do that? You can cut out portions that are deviated. You can reinforce them with pieces of cartilage that you've removed to strengthen it. And you can bring the supporting structures on its sides, like the upper lateral cartilages, to support it as well. If there's any deviation on the floor, which is part of the perpendicular plate or this bony structure, you can trim that and you can move the septum over as well. If the bones are distorted in any way, you can do precise cuts in the bone to shift them over to the right or the left, depending on what the patient needs. And those are the primary ways to fix a curved nose.